Next, I'd like to talk a little bit about the symptoms patients have when they develop brain tumors. Since the tumors arise in the brain, they can present to patients or become known through a variety of different ways. As the tumors grow, they can produce headaches because they push on normal brain and on the covering of the brain, which has many nerves, and patients will develop headaches. That's a very common way for brain tumors to present. Alternatively, the tumor may push on important areas of the brain. Many of us see people having neurologic problems in the setting of a stroke, and we recognize that the patient becomes weak on one side or has difficulty speaking, as I just did, or develops problems with walking or balance. Brain tumors often produce these same symptoms. One key differentiating factor is that a stroke is usually a very sudden occurrence. Brain tumors tend to come on more gradually because the tumor is slowly growing, and as it grows, it pushes a little bit more and a little bit more on the important areas of the brain. So it's very common for people to have subtle neurologic problems that become more pronounced, and finally either they or their loved ones say, something just isn't right, we should get this checked out. In the last decade in medicine, there's been a significant increase in the number of CAT scans and MRI scans that are done of the brain to work up things like headaches, falls from bicycles, double vision. And so more and more we're finding brain tumors that probably haven't caused any symptoms. As physicians, we call that an incidental finding. I fell off my bike, I bumped my head, I got a CAT scan, and lo and behold, there was the start of a growth of a tumor. In a sense, that's a good thing because we find the tumors while they're smaller, maybe at a lower grade, and while the patient is in better shape neurologically. And all of those things allow us to be more effective in treating the tumor.